Hello everyone. In this video, I am going to very briefly mention to you all how a PRRT practitioner go about assessing a pain patient in their clinical setting. Now, one of the most important thing that a PRRT practitioner keeps in his mind is that the whole body is integrated and none of one isolated segment is independent of the other areas. And therefore, there is a set methodology of 1 minute exam that I am going to share with you, by which the practitioner is able to identify the areas that have to be worked upon in order to treat patient successfully. Now, before I go about demonstrating this 1 minute exam, it has to be kept in mind that when the patient walks into the OPD and complains that, "Doctor, I'm having pain in this region," so this is a trap in such a way which catches your mind and focuses it on that area, and we immediately jump onto it and start examining it. PRRT practitioners are taught that how we go about assessing the whole body irrespective of where the pain is. So just follow along and see me how I screen the whole body for any pain patient. A set of around 25 areas are covered in the basic PRRT exam, where the therapist is going to assess both the sides one after the other and is going to compare the responses of the patient. Now, all you need is to develop a good dexterity and kinesthetic senses in your hand so that you can pick up changes in body area in terms of tone, texture, tightness, or barrier to entry. And we cover this training program in detail for practitioners who enroll into international certification PRRT courses. So let's get started. So the therapist starts by first assessing the medial gastrocnemius on both sides, then goes for the IT band assessment on both sides, looks for the facial grimaces and responses in the patient, and then we go about assessing the SI joint on both sides, followed up by the L4, L5 and L5, S1 facet joints. We see how good they are responding to our manual contact, and then we go about assessing the L1 vertebra, which again has a significance which we share in the training program, checking the 11th and 12th ribs which have attachment with the posterior fibers of diaphragm, checking the lower ribs anteriorly, which gives us an idea how the diaphragm is, and then we go about checking the upper ribs and the costosternal junction, and we check. You can see how the patient is behaving to our assessment. One side is painful and patient is having a pain response, and this dysfunction cannot be ignored. Then we go about and assess the upper thoracic spine. We check the left and right and we compare that. Then we check the levator scapulae on both sides. We check the first rib. Then we go about, we check the ligamentum nuchae. Then we check another important muscle, which is the splenius capitis. Then we check the C2 vertebra on the left and right side. Then we go about assessing the C1, mobility, occipitalis, temporoparaetalis. Then we go about checking the sphenoid on left and right, zygomatic arch, masseter. Again, there is a dysfunction right there. Anterior digastric, omohyoid, SCM, and then we go about assessing the posterior rotator cuff muscles on the left and right, the cervicothoracic junction. Then we also check AC joint on the right and left, and then we check another important muscle in the hand, which is the flexor pollicis brevis. And by this, we have a very good idea on how we can downregulate these areas of pain, because before we treat these areas, if we directly jump to the problematic area and start treating it, often the results are not so satisfactory. So come join us for the certificate programs in PRRT and develop the confidence of assessing and treating any kind of pain patient with more confidence and more success. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.